Coronavirus 2019 COVID-19, what you need to know. Facilitators for today, Yvette Wood, RN, MDiv, and Olga Hall, RN, Volunteers of America. Next. Tracking COVID-19, the USA has confirmed 4,200 positive cases as of 3/16/2020, 4 p.m. Maryland has 39 positive cases, North Carolina 33 positive cases, Virginia 45 positive cases, and the District of Columbia 19 positive cases. Next. What does it mean? It's serious, but we should not panic. We should continue to practice social distance, washing hands, covering coughs, staying home if ill, contact your doctor, and self-quarantine. Next. What does it mean? The target impact is individuals who are at risk for contracting coronavirus or who already has coronavirus. The actions taken is to reduce community spread. Regardless of age, there may be individuals who are positive and show no signs, so these measures by the government are protective. That is called flattening the curve. That is where a whole lot of people can contract coronavirus at one time, which would make a huge curve in our bell. But in order to flatten that, the government has taken protective measures to go ahead and put in force so that not as many people have a chance to be exposed to the virus. And that's why you see all of the quarantines and the stores closing in place. Next. Social distancing is a term applied to certain non-pharmaceutical infection control actions that are taken by public health officials to stop or slow down the spread of a highly contagious disease. The objective of social distancing is to reduce the probability of contact between persons carrying an infection, others who are not infected, to minimize disease transmission, morbidity, and ultimately mortality. In this case, the CDC recommends 6 feet. Remember to respect and do not outcast potential staff or consumers. Next. Social distancing. How can I explain? Social distancing would be if a person is 1.5 feet close to you, that's very intimate contact. If they're 4 feet away from you, that is considered casual contact. If they're at least 6 feet away from you, that is social distancing. And most of the public should be 12 feet away from you. Next. Residential staff guidance. Remain calm, show concern for client/consumer, contact your supervisor and manager immediately. Management will notify all staff of possible contact with COVID-19 and take the next steps to protect staff and consumers. Next. Continuation of residential staff guidance. Remain calm, show concern for client and consumer, initiate isolation precautions on diagnosed or presumed positive client or consumer. Clients living in resident homes must be quarantined in a separate room. Please keep the room door closed at all times. Prompt implementation of recommended personal protective equipment for all staff, and infection prevention and control measures must be taken immediately. Next. Reinforce COVID-19 signs and symptoms for all staff so they will know what to look for, such as fever, cough, shortness of breath, fatigue, chills, body aches and pains, headache, diarrhea. Avoid sharing dishes, bedding, and other household items. Next. Monitor client for worsening of symptoms, such as if a fever is higher than 102.5, or the client begins respiratory distress symptoms, which are color changes, retracting while breathing, nose flaring, sweating and wheezing, call 911. Please be sure to inform the EMS that the patient is possible COVID-19 or COVID-19 positive. Next. Resident quarantine for 14 days if they are positive. Sanitize and aerosol living area several times a day. Staff, please be sure to take rest periods. Do not allow any visitors or oncoming staff into resident home without supervisor's permission. Obtain physician orders for daily temperature checks on all clients living in the resident's home. Staff who are present in the home should also check their temperature daily. Arrange for food and medical supplies to be delivered to the residential homes, and staff and clients should remain hydrated and hydrate often. Notify anyone who may have entered the residence of a COVID-19 positive test that there's someone there, and supply them with personal protection equipment. Next. Guidance for non-residential staff. Olga?
Thank you. Guidance for non-residential staff. Screen everyone entering into the facility for symptoms of acute respiratory illness, fever, cough, difficulty breathing, and do a good visual assessment. Separate clients with respiratory symptoms and place a face mask on them to minimize spread. Strict hand hygiene with 60% or higher alcohol-based hand rub, soap, and water for at least 20 seconds. Routine cleaning and disinfection procedures should be completed several times daily, including aerosol generating procedures. Next. Guidance for non-residential staff, Part 2. Keep the essential personnel emergency contact list with contact information for your supervisor and local or state health department. Routinely clean all frequently touched surfaces such as workstations, countertops, and doorknobs. For suspected exposure to COVID-19 patients, contact your supervisor right away. For staff with suspected exposure, will be placed on home quarantine for 14 days and should not report to work under any circumstances. After 14 days, contact Linda Bunn at lbunn@voces.org for further instructions. This information is covered with protected health information. So you'll have to go to your doctor and get a release. Next. Community-based staff guidance. Review your process for planning face-to-face services before you start services with the consumer. Screen your client or consumers for symptoms of COVID-19 illness, such as fever, cough, difficulty breathing, body aches before beginning interaction. Also checking to see if the patient has traveled out of the country recently or been in contact with anybody with the symptoms. See your supervisor and carry PPE with you at all times. Next. Screen area for social distancing protocol. Sanitation of personal belongings, work areas, work equipment. Suspend all face-to-face interactions when at all possible, and utilize telemed and phone sessions where possible. Monitor CDC and World Health Organization guidance. Next. Administrative staff guidance. Follow your office guidelines for remote work. Enforce workplace hygiene. Continue to stay informed about the local coronavirus situation. Know where to turn for reliable, up-to-date information in your local community. Monitor the CDC COVID-19 website and your state and local health department for the latest information. Next. Administrative staff guidance, Part 2. Ensure proper cleaning of building and personnel workspace is completed daily. Make sure supplies are available, such as tissues, waste baskets, alcohol-based sanitizer, and personal protection equipment if needed. Screen all visitors for symptoms, such as fever, cough, and difficulty breathing, upon and or before entering the work setting, and contact your supervisor if you are ill. Do not report to work. Next. Administrative staff guidance. Employees who are sick should contact their supervisor and stay home. Personnel who develop respiratory symptoms, like cough, shortness of breath, should be instructed not to report to work and to contact their doctor for further instructions. Supervisors must place posters that encourage staying home when sick, cough and sneeze etiquette, and hand hygiene at the entrance to the workplace and other workplace areas where they're likely to be seen. Advise employees before traveling to take certain steps. Check the CDC travelers' health notices for the latest guidance and recommendations for where they will travel. Next, employees who are sick should contact their supervisor and stay home. Personnel who develop respiratory symptoms, such as cough and shortness of breath, should be instructed not to report to work and contact their medical provider for further instructions. Supervisors must place the posters that encourage staying home when sick, cough and sneeze etiquette, and hand hygiene at the entrance to the workplace and in other workplace areas where they're likely to be seen. Next. Questions and answers. If we need to separate or quarantine an individual that may be sick, how do we do so while remaining in compliance with human rights regulations? Technically, isolation meets the definition of seclusion in the human rights regulations. Thus, if a provider isolates an individual, the requirements for seclusion contained in the regulations would apply. Based on a temporary waiver to the regulations by the commissioner, if a provider is going to isolate an individual who has COVID-19 or is suspected to have COVID-19 or has been exposed to someone with COVID-19, the provider should explain the process to the individual, if applicable, document a conversation with the qualified healthcare professional. Next. Indicate the symptoms or circumstances that warrant isolation. Notify the Department of Behavioral Health, Disability Services via email to the regional advocate and comply with internal emergency infectious disease policies. If the isolation lasts longer than 7 days, the provider must document the need for the restriction in the individual's service record. Any individual AR who believes his or her rights have been violated can make a complaint directly with the provider or through the advocate. Next. Yvette, would you like to?
Question B. How should home health aides monitor or restrict home visits for healthcare staff? Healthcare providers who have signs and symptoms of a respiratory infection should not report to work. Any staff that develops signs and symptoms of a respiratory infection while on the job should immediately stop work, put on a face mask, and self-isolate at home. Inform the home health clinical manager of information on the individual's equipment and locations of the person who came in contact with. Contact the local health department recommendations for next steps, including testing, locations, and treatment. Next. Question C. What guidance is there around how licensed providers may restrict visitors to mitigate risk around the spread of COVID-19? While providers shall not limit or restrict the rights of individuals more than is needed to maintain a safe and orderly environment, based on a temporary waiver to the regulations by the commissioner, a provider that is going to limit visitations for individuals in the program shall ensure the following. Each individual and his authorized representative, if applicable, must receive a copy and a revised visitation policy. The information should include a clear explanation about the change in visitation and information about when the change will be discontinued. And the change to visitation shall be posted in a summary form in all common areas. Next. How to use a mask. For healthy people, wear a mask only if you're taking care of a person with suspected COVID-19. Wear a mask if you're coughing or sneezing. Masks are only effective when used in a combination with frequent hand cleaning with alcohol-based hand rub or soap and water. If you wear a mask, then you must know how to use it and dispose of it properly. Masks represent the practice of in reverse isolation, meaning the masks are for consumers to confine any sharing of bacteria from staff, Masks are in limited supply and will be supplied to the programs that have the highest risk. Please speak with your supervisor regarding requests to wear a mask. Next. And this concludes our COVID-19 update. If you have any more questions or answers, please reach out to your managers, supervisors, Yvette Wood, or Olga Hall. Thank you.